Ever since I decided I wanted to go into medicine, I kind of always thought I was going to end up in pediatrics. I kept an open mind throughout medical school, and realized, yes, I definitely like practicing pediatrics. I like the idea of being useful outside of a hospital setting. I like the idea of having little extra skills, more practical skills. As I went through residency, I actually found that I got all of that in sports medicine, which is great. I love it. So I practice a bit of both. I see babies, but then I also see up to college athletes as well. First goal always, whenever I meet with a patient, is to figure out what's going on. So I always ask a lot of questions to have them tell me the story. I usually say that, tell me the story, what happened? But then after that, I do a physical exam. So especially with sports medicine, that's really important. So being able to locate exactly where that pain is. And then after that, I say, we're gonna generate a game plan together, kind of figure out what our next steps are gonna be. I always try to ask the patients questions directly. I always like to hear exactly how they describe something, how they tell me when things started, and kind of sometimes I get a little bit of both information from the parents and the patient that kind of conflict a little bit, but I always try to include the patient in the discussion. If it's a teenager for say a well visit, I always like to kick family out of the room at the very end just to give them a chance to ask any questions they might have. I've been a patient that when I first meet, because I come in kind of hot sometimes, loud, smiling, and sometimes I get a little shy, and by the end, having them laugh, I do a little magic trick where I find stickers in their ears and just joke around with them. That's always my favorite part, is having a child that comes in nervous, a little bit concerned, and leaving relaxed, and parents feeling like, yeah, we got an idea, we got a game plan for what's going on. I want my families to know that like I will do everything I can to help them. And sometimes that means not treating, and sometimes that means looking at different options. I will always try to make sure that one, I'm not making something worse, and two, treating the appropriate condition. That's always a big priority of mine, making sure that they know that yes, I will put in work behind the scenes to make sure that your child gets the care they need.